As we age, one of the most profound and underestimated physiological shifts we experience is the gradual loss of skeletal muscle mass and strength, a condition known as sarcopenia. This process doesn't happen overnight, and it rarely announces itself with obvious symptoms until the damage is already done. Beginning as early as the fourth decade of life, muscle mass begins to decline at a rate of roughly 3 to 8% per decade, with the rate accelerating significantly after age 60. By the time someone reaches their 70s or 80s, they may have lost up to half of the muscle they had in their younger years. The consequences of this aren't just physical weakness or reduced stamina. They reach deep into the core of the body's metabolic engine, setting the stage for obesity, frailty, insulin resistance, and chronic disease. Muscle tissue is metabolically active, meaning it burns calories even when you're at rest. It's a critical determinant of your resting energy expenditure. When muscle mass decreases, so too does the number of calories your body burns on a daily basis. This metabolic downturn often goes unnoticed, leading to a creeping weight gain that is mistakenly attributed to poor willpower or diet alone. In reality, the body is undergoing a major internal shift in energy dynamics. Without compensating through either increased activity or reduced caloric intake, the energy surplus gets stored as fat, particularly around the abdomen and organs, where it is most metabolically harmful. One of the most dangerous aspects of sarcopenia is its self-perpetuating nature. As muscle mass declines, physical activity tends to drop. Tasks that were once effortless, climbing stairs, carrying groceries, getting up from a low chair, become harder, which leads to more sedentary behavior. This inactivity, in turn, accelerates further muscle loss. This vicious cycle sets in motion a chain of physiological dysfunction. Reduced muscle leads to lower metabolism, increased fat accumulation, higher blood sugar levels, inflammation, and a greater risk of conditions like type 2 diabetes, cardiovascular disease, and even certain cancers. And here lies a serious warning. Sarcopenia is one of the key drivers of age-related disability and dependence. It's not just about strength, it's about survival. Older adults with severe muscle loss are at much higher risk of falls, fractures, hospitalization, and loss of independence. Once someone becomes physically frail, recovery is extremely difficult and often incomplete. Unfortunately, this condition is vastly underdiagnosed, and many people unknowingly walk a slow path toward frailty because they assume physical decline is a normal part of aging. While aging is inevitable, severe muscle loss is not. The good news is that sarcopenia is not an unstoppable force. In fact, it is one of the most modifiable aspects of aging, if action is taken early and consistently. Resistance training remains the most effective intervention. Lifting weights or engaging in bodyweight exercises like squats, lunges, or push-ups stimulates the body to maintain and even build muscle, even well into old age. It's not just for bodybuilders or athletes. Studies have repeatedly shown that individuals in their 70s, 80s, and even 90s can gain muscle and improve strength with proper resistance training. Diet plays a critical role as well. As people age, they often consume less protein, whether due to appetite loss, dental issues, or outdated dietary advice. But older adults actually require more protein per kilogram of body weight than younger adults to maintain muscle. Distributing high-quality protein, especially from lean meats, dairy, legumes, or plant-based sources, throughout the day is essential. Including leucine-rich foods such as eggs or whey protein can specifically help stimulate muscle protein synthesis. Vitamin D and omega-3 fatty acids also deserve attention. Vitamin D deficiency is common in older populations and is associated with lower muscle function. Omega-3s, particularly EPA and DHA from fish oil, have been shown to improve muscle strength and reduce inflammation that may impair muscle regeneration. Sleep and recovery are other often overlooked elements. Without proper rest, the body's ability to repair and build muscle is compromised. Aging bodies may need more attention to sleep hygiene, stress management, and inflammation control to create an environment conducive to muscle preservation. Lastly, mindset matters. Too often, people accept muscle loss as inevitable and stop challenging their bodies, which accelerates the decline. But the reality is that age alone does not doom anyone to weakness or obesity. The human body has a remarkable capacity for adaptation, even late in life. What it needs is stimulation, proper nourishment, and consistency. In summary, sarcopenia is a silent threat with sweeping metabolic and functional consequences. It's a key reason why older adults struggle with weight gain and rising blood sugar levels, despite eating the same as before. But it is also one of the clearest opportunities for prevention and reversal. With targeted exercise, adequate nutrition, and a commitment to proactive aging, muscle mass can be preserved or even regained. The alternative, ignoring it, leads to a cascade of physical, metabolic, and emotional burdens that are much harder to undo. Muscle is more than strength. It is protection. It is vitality. It is independence. And it is worth fighting for at every stage of life.